I call this meeting to order. Roll call, please.
Councilmember Luis Cabrera. Councilmember Lisette Servin.
Presente.
Councilmember Maria Cecilia Cruz.
Present.
Councilmember Esteban Rosales.
Present.
Councilmember Javier Vargas.
Present.
Vice Mayor Tadeo Sael de la Hoya.
Present.
Mayor Nieves Raydel.
Present.
Mayor, you have a quorum.
Thank you. Councilmember Cruz, would you please lead us?
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you.
Item number 3, discussion and possible action items. Item number 3A, discussion and review on any and all matters regarding the Employees' Health Benefits Plan. Dave Madden, CBIZ Benefits Consultant.
Good evening. I'm Dave Madden. I'm with CBIZ. We've worked with the city since a little over a year and a half, 2024. We help the city with all of the employee benefits and insurance. And because you self-fund your medical plans, we help you with all of the risk management. So if you folks are like me, I have that task of trying to take hours upon hours of discussion and planning and crunching of numbers and try to put it into 10 minutes for you. So I'm going to cut forward to slide 6 if you're good with that. If you want to spend some time and read more about who we are, what we do, the slides are all there for you. But I want to jump into talking about the cost. Obviously, that's one of the most important factors in all of the discussion around the employee benefits program. But I want you to think about it in 2 ways. You always have a fixed cost, right, an administrative cost for all of the benefits. And then you have, because in particular on your medical plan, your pharmacy plan, you have claims cost. That's a very significant portion. I'm going to talk a little bit about each of those today, and I want to really talk about what's driving those costs and what our actuarial projections are for your upcoming plan year. So high level, when you look across all of your administrative fees, this is going to be for all of your employee benefit programs. So the different types of life insurance, your EAP programs, your vision program, the network access fees for SireMed, for Blue Cross Blue Shield, for the third-party administrator that answers the phones and pays the claims. As you can see, as you look across the board, you're in fairly good position. It's a very nice position. As you can see, you have either flat renewals or you have low single-digit renewals across the board. So that is all very, very positive. I want to move forward now. I'm going to jump back to that slide, but I want to dive now into the elephant in the room, and that is the medical plan, because the medical plan is $3-4 million a year. And I want to break down a couple of pieces that are driving the cost associated to the medical plan. Recall a moment ago, I mentioned you have your fixed costs, and then you have your claims costs. On the medical plan in particular, that's your pharmacy plan, your stop loss or your excessive or catastrophic claim costs, those fees represent approximately 20% of your total cost. The claims represent the other 80%. So for a moment, let's talk about the 20% of cost, because that 20% is actually very, very significant and is becoming more significant. So as you look at this slide, this shows each of these different administrative components of your fixed costs, from the folks that answer the phones. I mentioned a moment ago the folks at Blue Cross Blue Shield, you rent their PPO network for your plans, the SireMed network, some of the utilization management fees, your stop loss fees, wellness programs. As you look down the board here, as you can see, again, most single digits, there's one that's going to jump out to you, and that's your individual stop loss. And that's an important one, because that is becoming increasingly as expensive. And as you can see here, it's nearly $600,000, and that drives the vast majority of your fixed cost. And as of our projection going forward for 25-26, you can see your fixed costs are $1 million. So that's a significant amount of your spend. So I wanted to provide some detail in terms of what's driving your fixed costs. And now let's go back and talk about what is driving that 16% increase on your stop loss policy. Stop loss, that's a catastrophic insurance. If something really bad happens, you have an insurance carrier that backstops you and picks up that cost for you. And so we'll talk a little bit about that. So I'm going to back up a slide, and I wanted to share with you, after we looked at all of the different claims data, there's a lot of math behind this. Happy to unpack that and go through it in detail with you if you'd like. We've done that with the city leadership. I wanted to talk a little bit about what our actuarial findings are for the upcoming plan year. And it's really driven by the Pareto principle. I don't know if you're familiar with the Pareto principle. It kind of varies at times, but 90% of your costs are driven by 10% of the population. That is really what's going on here. When you look at your population, for the most part, it is a healthy population. You have good claims experience, but unfortunately, like all employers across the country, we're getting older, and the conditions that we have, plus inflation, is driving cost. And you are no exception, unfortunately, to that rule. 90% of your cost is being driven by a handful of your employees and their family members. And so when we did our actuarial study, we looked at what your recent costs are, some of the emerging claims. We add on what we think is going to be inflationary costs around medications, around provider services, hospital services, and those types of things. We arrived at a recommended 32% increase in funding for your medical plan. And I wanted to call out something here. If you look down there along the right-hand side, this was put together a couple of weeks ago. And I went on vacation and I gathered some information just last week. You actually have a fourth claimant. I have here, you have 3 people that are what we would call catastrophic claimants that are driving a significant portion of your costs. We received notice that you had a claimant in March that was over $700,000 in claims for the plan. And so when you think of that, you have 3-4 people who are driving a pretty significant amount of your cost. As we project forward and we look at what that risk represents for the city, we look at this and we say at the very high end, from an actuarial perspective, a 55% increase in funding. But when we look at what we expect, and there's a little bit of margin in here because we are actuaries, and actuaries are very conservative folks, we think fairly a 32% increase in terms of funding for your medical plan is what's called for in 25-26. I'm going to jump forward. Here's a little bit of what those fees actually look like. You can see your funding rates, your enrollment based upon the 2 medical plans. We applied here the 32% increase. You can see that that's what the actual rates would be based upon your current contributions. That is what is the city contribute to the employee benefit plan, as well as what is the responsibility of the employee. I'll jump here very quickly. Again, I'm moving very quick because I want to be respectful of your time. I was told I had 10 minutes, so I think I'm on schedule. Let's talk about the dental funding plan. This is in line with what's happening in the marketplace in terms of trend, in terms of utilization, as well as just inflation. What is the cost of services? And so when we did our actuarial study, again, looking at the total plan, looking at your historical spend, looking at what the costs, the inflationary costs are in the marketplace, and what the anticipated utilization by your employees and family members are going to be, we landed at a 12% increase for 2025. And you can see that here. Here's some of the workup. And as I mentioned a moment ago, there is some margin in here. Our actuaries are conservative people. They don't want to get this wrong. And so we did have a chronic load, a 1% margin, but we used an industry standard of 3.5% trend and applied that to your claims. And so landed at about 12%. And then the final thing that I just wanted to share with you, actually, not the final thing. I have one more thing after this. The dental implant coverages. That was one of the additional coverages that was that the city inquired. Wanted to add that as a benefit, and here is what we recommend. And the good news here is we didn't believe it had any material impact on cost if you were to improve the benefit and offer that. So that is a very, very quick overview of the employee benefits plan in particular, what's driving the cost. But I wanted to spend maybe 30 seconds here in terms of looking forward, some of the things that we'll be working very closely with the city on to really try to continue to move forward, manage the risk within the plan, 32% increases. No matter who you are, that is very, very difficult to stomach. It is not sustainable. And so managing that risk is very, very important, but at the same time, working with the city to identify opportunities to be efficient in terms of how the plans are administered, in terms of staffing and their time, but also making sure that the benefits are attractive, they're competitive, and those people that are in need of care are getting the care that they need and they're getting high quality care. And so we've already started that work, but I'm excited. I'll be back next week. We're going to spend a half day sitting down and looking at the plans and planning forward the next year in terms of some of the strategies that we want to recommend to the city around managing the risk. So I will stop there and certainly take any questions that you might have.
Comments, questions from council?
I have a couple of questions.
Absolutely.
One, in your expert opinion, how often do those 3-4 claims occur a year? Is it an every year?
Okay, yeah, very good question. There is a statistical answer to that for every 10,000 lives. I don't want to share a guess with you because I fear that it would be wrong. I'd be happy to follow up with you with the statistical. However, I can tell you in experience, this is very normal. 3-4 claimants above the stop-loss threshold is very normal. It's something that's unfortunately very common for an employer of your size. When I look across my book and other employers of your size, you're actually in fairly good shape. I have many employers that are 7, 8, 9, 15 people that are above the stop-loss level. So 4 is a pretty good solid number.
So for us, statistically speaking, history-wise, is this an yearly thing that happens every 2-3 years? That's my question.
No, not generally. You're almost every year you're going to have 1 or 2 people that are going to push up against you. You have a $100,000 spec deductible, may push over it. You're always going to have a couple of those folks every year for an employer of your size. It's the big one that you're talking about. I'm assuming the $750,000, $60,000. That is generally every 3 to 5 years you're going to get one of those.
Thank you.
Yep.
Well, one more.
Yeah.
What's the average price on a dental implant? One.
I don't know the price.
Okay, thank you.
Yep.
Anybody else?
I do have a question.
Yes.
On the dental implants, well, maybe this isn't a question for our HR department. I just want to know what the average age is for employees on, I don't know, maybe it's an HR question, so I'll ask it later. For the dental implants, since you're considering adding that, what about adding braces, like the brackets also? Is that something that was considered before or even thought about, or?
I wasn't requested to do that, but happy to take a look at that if that's something that you want to explore.
Okay.
Yeah.
All right. No, that was just my question. I'll ask HR the other one. Thank you.
Sure.
Anybody else? Staff? No?
Mayor, I would like to just make a comment.
Sure.
Thank you for your presentation. The increase is 32%, which seems very high. But you gave me ease, you put me at an ease because you said the 3 to 4 individuals is like a normal number. So that's good. I was getting like worried, but thank you for that number that Vice Mayor brought up. So thank you. I just wanted to comment that then. that's comforting, that it's at a normal.
Yeah, it sounds strange saying it's normal. These are human beings, you
But
know?
compared to
Yeah.
other cities, that have 7, 8, so thank you.
Yeah, keep in mind, you have stop-loss insurance. That's that extra layer that helps protect you against these things. As you can see, it was a 16% increase for that extra insurance, but you have certainly used it, and it's protected the city well. In fact, 600,000 of those dollars, of that $750,000 claim, are going to be reimbursed to the city based upon that policy. So the policy has served you very well.
Thank you.
Anybody else?
Mayor,
Yes.
maybe the council might want to know what the increase would be per employee, per family. Is that something you'd be interested in hearing about?
Well, you asked the question. David?
Good evening, Mayor, Vice Mayor, and council members. And you wanted to know what's going to be the actual increase. So employee alone currently pays 0%, and the increase is going to go up to $79.84 per month, or about $40 per paycheck. Employee plus spouse or plus children currently pays $285, and it's going to go up to $327. And then family currently pays $435, and it will go up to $500. And I'm only doing the US plan, which is the most expensive.
Adela, can you share that with us, in an email, so we can, when city employees approach us, we will be knowledgeable? Because then sometimes they get the wrong information, or they don't know, and then it gets out of hand. But if we have the right information, we can help.
We will send out a communication with the table that has the rates, yes.
Thank you, highly appreciated. Anybody else?
Mayor, one more question. Adela, how long has it been since the employees had to contribute to the benefit plan?
From what I gather in history, it's about 8 years that there has been no increase to the employees' portion of the premium.
Wishing that is pretty outstanding. Things are going up, and it makes sense. I'm pretty sure that it's gonna hurt pocketbooks of the city employees, but it's better to have that than not having health insurance. That's my personal opinion.
And Mayor and Adela, you can share, but from what I'm hearing from the other communities in the county, all the increases will be impacted throughout the employees within Yuma County, within the municipality. So it's not just us that we're asking the employees to contribute. I'm hearing from the county, from the hospital. So a lot of the employees are having to contribute this year. So just wanted to make sure that the employees had not had to pay a contribution for the past 8 years. So that was pretty decent of us.
Pretty good, right?
And if it helps too, when we send the communication out, we can also put information from the other municipalities. Yuma currently, the employee has to pay $257, and that's in the current plan, but they're also talking about increasing. Somerton, they're talking about increasing, but they still have 0. But everybody has indicated on the research that they're looking at increased premiums.
Yes.
Adela, can you, about the 32% increase, can you share with us how is that going to be split between the city and the employees?
Yes, that was actually on the next item. I can cover that if it's okay. Do you have to read anything, Sonia?
Mayor, if I may, for the record, I would like to read the item.
Yes, please.
Item number 3B, discussion and possible action on any and all matters regarding the employees' health benefits plan renewal and premiums increase. Adela Cortez, Director of Human Resources, and Roula Encinas, Director of Finance.
Okay, so as David presented on his item, the increase that is anticipated, or the total that is anticipated for the new fiscal year is 4.3 million. Currently, employees contribute, I don't have it here, one moment. Employees currently contribute a total of 417 or 418,000. That's gonna be increased by 252,000, which is gonna make the total employee contributions 670,000. The city's current contribution is 2,900,000, and it will be increased to 3.7 million. So together with the 670, that'll make the 4.3 million that is the anticipated need for the new fiscal year.
Any questions on this particular item before we vote? Anybody?
So it was presented to the trust, what was going to be needed to cover the anticipated cost in the new fiscal year. And the recommendation is that given what we were talking previously about employees not having an increase in premiums for 8 years, that there is a partial cost sharing, and we already discussed those increases within the previous item.
Questions, comments? No? Vice Mayor?
No?
And then I will entertain a motion.
Mayor, I move to approve the Employee Benefit Trust recommendation for a cost sharing of the premium increase and an allocation of 3.7 million to the trust for fiscal year 2025-2026.
There's a motion
Second?
and a second. All those in favor signifying by saying aye.
Aye.
Any nays?
Nay?
Let's do roll call. I want to be consistent.
Councilmember Lisette Servin,
Aye.
Councilmember Maria Cecilia Cruz,
Aye.
Councilmember Esteban Rosales,
Aye.
Councilmember Javier Vargas,
Aye.
Vice Mayor Tadeo Sael de la Hoya,
Nay?
Mayor Nieves Raydell,
Aye.
Mayor, motion carries.
Thank you. Thank you, ladies.
Thank you. Councilmember Servin, regarding your question about braces, our current plan covers braces for dependents only, and it is at 50%, up to 19 years of age, and the dependents must be in the plan for 1 year before they can have the coverage.
Oh, okay, thank you for that, for the clarification. And also for the implants, will that be possible or covered for a family as well, or it's just for employees? The implants?
It is for anyone that is enrolled in the plan.
Okay, thank you.
Okay.
Thank you. Anybody else? I want to thank Mr. Mayor. Thank you for your presentation. It was quick and to the point. Thank you. And with that, I want to take a motion to adjourn.
So moved?
Second?
There's a motion and a second to adjourn. All those in favor signifying by saying aye.
Aye.
Any nays? Motion carries. Thank you, everyone. Thank you.